You're tuning into the Active Mom Podcast with physical therapist, Dr. Carrie Pagliano, a real mom's guide to all things postpartum return to workouts after baby. If you're a postpartum mom, coach, trainer, or physical therapist looking for answers on how to get back to running, CrossFit, yoga, Pilates, HIIT, you name it, without the fear of pelvic floor issues or doing something wrong, this is the podcast for you. Let's start the show. All right, so our next guest came from a recommendation of a friend of mine. You guys have heard her before on the podcast, Kelly Kendall, who goes by the Balanced Boob, who's a lactation consultant and recently just had a hysterectomy, been navigating some endometriosis and that kind of stuff. And she said, Carrie, you need to check out JOCELYN. And I did, and I was intrigued. And honestly, since I've been following, it's the algorithm, right? Since I've been following her account, I've seen more and more friends going through these pelvic surgeries. And I was like, hey, you know what? Let's have this conversation. So JOCELYN Wallace, who's also a PT, she's going to share her story and welcome to the show.
Yeah, thank you so much for having me and for bringing awareness and welcoming this topic on your platform. I am a physical therapist and I specialize in helping people recover and return to fitness after pelvic surgeries. So hysterectomies, myomectomies, endo excisions, prolapse repairs, basically everything that's not directly related to the perinatal space. I came into this in PT school when I had my first open myomectomy to remove uterine fibroids and got to see firsthand how little support there was out there. Even my professors had never heard of a myomectomy, didn't know what it was. So I felt lost despite having a lot of resources. And since then, I've had a second open myomectomy where I had 47 fibroids removed, a C-section, and then a hysterectomy in May of this year. So about 5 months ago, as of recording this. So having been through the whole journey, I've gotten to witness how little support there is out there for women and how much value and how much better the experience can be with a dedicated rehabilitative process. Just like we speak about so much with postpartum, it's so much more than just rest 6 weeks and then figure it out by yourself. We can support people so much better. And I've gotten to witness that firsthand as a patient, but also as a provider, now directing my practice towards only working with these people.
Yeah, isn't it crazy how we get into these things because of the crappy care we've gotten?
Yeah.
It's like, oh, we got to do it a better way. All right, let's backtrack
Yeah.
to PT school because I'm sure that you had a very similar experience to me in that you get really nothing, one, about pelvic, and two, definitely nothing about pre or post-op pelvic surgeries, because I feel like we barely touch on that stuff in like basic orthopedic stuff. Like where did you go to school and
Absolutely.
what was your experience with that?
I went to Nova Southeastern University, and the pelvic floor content was 1 3-hour lecture. So one afternoon.
I think I gave a lecture there. And it might have been that lecture. So clearly you were not in it. And I didn't talk
Yeah,
about
it was
pelvic
not you.
surgeries anyway. This was, oh my gosh. I'm going to have to look back. It was at least probably 7 or 8 years ago. I think they just invited
Yeah.
me down once. They didn't invite me back. I don't know why not. So maybe you can ask them. But no, I know for a fact, like, because in 3 hours, there's no way you can hit
Yeah.
all those things.
Yeah. Even in my
So,
pelvic floor education, the mention of fibroids, hysterectomy, it was like a little
mhm,
byline on a slide.
right, exactly.
Very minimal.
Exactly. And I think it's such an interesting thing too, because, we're PTs, we're like rah, pre-op, post-op, but what does that actually mean? Right? Is that
Mhm.
for every little surgery? Is that like, and then what does pre-op look like? So your very first surgery, first of all, how did you even get a diagnosis? Because I think that's the first problem that women run into is they know something's wrong, something doesn't feel right. They don't know where to go or what to do. So how did you
Mhm.
even what was your first experience with discomfort?
So I was very lucky that I was raised in a family that's very open about these kinds of issues. So I knew from a young age that a lot of the women in my family had fibroids. A lot of the
Mhm.
women in my family have had hysterectomy. So I knew what was happening once I started having heavy bleeding and all of the symptoms of fibroids. So it
Yeah.
wasn't a surprise for me or a long path to diagnosis for me. With fibroids specifically, one of the cardinal symptoms is heavy bleeding, but not everybody has heavy bleeding. A lot of people have bulk symptoms. So that might feel a lot like prolapse. Like sometimes people will
Mm,
express that it feels like something's coming out of them. Sometimes people have bladder changes, like a lot of frequency, urgency, pressure, trouble emptying, constipation, severe bloating. A lot of times, the first clue is people will start feeling weaker for no reason. So, as
hmm,
the fibroids start to pressure the abdominal wall and start to put pressure on that area, people will find that their back hurts when they do flutter kicks, when those never gave them a problem. So, those are all examples of bulk symptoms that can
mhm.
help to indicate that something might be growing as far as a pelvic mass.
So, to even back up a step, like,
Mhm.
when you say fibroid, I don't, like, what do people think of fibroid? Like, what did you think it was? And then when you finally got to see yours, like, what is it actually?
Yeah. So the what you'll see when you Google is that it's a benign tumor that grows inside of the uterus. It can be inside the uterus completely. It can be in the muscular wall. It could be completely outside of the uterus, or it can even be a pedunculated fibroid, which means it's like on a little stalk hanging off of the
Oh,
uterus. So
it
there's a
sounds
lot of
cute, but it's
different
not.
yeah. In my head, I just have always kind of imagined them as these, like, little balls, these little tumor-like balls, but in
Yeah,
reality, they can be absolutely gigantic, and they can have a lot of different qualities to the tissue, so they can become calcified and really firm.
yeah.
They can degenerate or lose their blood supply, which can be excruciating. They can also just be these, like, pink, kind of gross-looking balls of muscle organ-like tissue. It's just a little bit it's organized the tissue is organized a little differently from the uterine muscle, so it looks different.
Okay. And you mentioned you've got a family history. Is that something that's pretty common? Is like if you know that a certain relative has a history of this, that it's you have a genetic predisposition?
It seems to be that there's a genetic predisposition to it.
Yeah.
About 50 to 80% of women, depending on what study you read, will
Wow.
encounter a fibroid at some time in their life. But someone like me who has had them so severely so early in life, I started getting them in my early 20s.
Hmm.
That's more on the rare side of things. And
Yeah.
people in that boat tend to be more genetically predisposed to it. But most women will have some fibroids if you went
Yeah.
looking for them. But not everybody is going to have life-altering symptoms.
So when you first started having your period, I'm asking all these because I have a soon to be I have 2 kids basically diving headfirst into puberty right now, so I'm, like, drinking from the
Yeah.
fire. Also in menopause myself. So, like, did you have normal periods and not all of a sudden you're like, "Hey, that something is different in your 20s," or
Yeah.
and that's how you kinda differentiate it from, like, an endometriosis or something like that? But, like, what was your experience?
So they were always heavier than normal,
Mm,
but not catastrophically. In my early 20s, they started becoming like catastrophically heavy. I was extremely anemic. My hemoglobin would drop,
mm,
white as a ghost. Like I was getting really unwell. But looking back, they had always been heavy. Something that can help
mhm,
to sort of delineate or distinguish from endometriosis is fibroids will typically be symptomatic on a cyclical basis,
mhm.
where endometriosis is symptomatic all the time. Like, it's
Yeah,
much less predictable, it's much more painful. Women with fibroids do have pain too, but generally the 2 degrees of pain are different.
yeah. Well, that's the other thing too. I feel like it's now socially acceptable to be even having these conversations out loud because so many people have come out to talk about endo and I feel like the fibroid conversation has
Mhm.
kind of come with it a little bit more. But the context in which I've always heard of it with patients is, like my doctor said my fibroid's the size of a grapefruit. I'm like, that's why things don't feel good because
Yeah.
it's huge. Like, and you're trying to kind of put all this stuff together to help put a clinical picture together. For you, when you're first experiencing this, you're understanding what's going on. What were the choices that you were given?
So when I was first diagnosed, I didn't know any better as far as seeking out, the best surgeon I could and getting opinions. Then we've come so far since I had that first surgery as far as what kind of treatments are available and such. But back then I didn't know any better. I just went to my school gynecologist and he immediately referred me for an open myomectomy, which is like a C-section cut at the bikini line, and then they go in and they remove the fibroids. So I just went with his initial recommendation. I didn't seek any other alternative opinions. My
Mhm.
second time around, before pursuing my second open myomectomy, I did look into all of the different treatment options that are out there.
What was the second time around? What did you learn that you did not learn the first time?
Yeah. So the second time around, I sought out opinions from 2 interventional radiologists. So for fibroids, they do something called uterine fibroid embolization. So they go in with like little particles. They can go in through your femoral vein or your vein in your hand. And they go in and they put these little particles into the blood supply to the fibroids and basically starve them of blood.
Mm,
So it can be a really cool treatment. It can have the studies show about 50 to 60% success rate, but much less invasive, of course, than a surgery. So I explored options with 2 interventional radiologists to look into that. And then I looked into something called Sonata, which is like an ultrasound ablation kind of thing of the fibroids where they target them. But I ended up choosing a second surgery just because my fibroids were so severe.
mm,
And in that, while going through that, my husband and I were also trying to conceive. We went through about 18 months of fertility workup and all this stuff. And I kept being told I only had 2 or 3 fibroids. But once you've had an open myomectomy, you can often develop scar tissue and your bleeding can change. So, like, my
mhm,
bleeding wasn't matching the severity of my bulk symptoms. So, the
mm,
second time around, I was having really severe bulk symptoms, pressure, constipation, just like constant discomfort. Felt like my body was full of concrete. So I was having a lot of those sorts of symptoms, but kept being told my ultrasound only showed 2 or 3 medium to large fibroids, and I just knew in my gut that it was worse than that. So
mm.
the interventional radiologists were telling me like, "Yeah, you're a great candidate. You only have a few fibroids." Um, but I just knew that it was worse than that. So I ended up consulting with a gynecological surgeon and she was willing to do a myomectomy. She did a second open myomectomy because I already had the incision. So she went back through my old incision and she was the one who removed 47 fibroids in one shot. So my ultrasound was way off. So I'm quite
It
glad that I listened to my body and correlated it with those bulk symptoms.
it sounds like when they predict babies' weights and they're like, "Oh, your baby is gonna
Yeah.
be this huge baby," and it's like 6 pounds. Like,
Yeah.
how do they get this stuff so wrong? Like
So I think the way she explained it was in the image, in the ultrasound image, they were just so clustered that it just looked like a
it
few,
just
but
looked
there
like,
were
"Oh
so
my
many
god."
that the image was just indistinguishable. My
Yeah.
uterus was just completely full of fibroids. But on the topic of choosing a surgeon, I went to a fellowship trained, minimally invasive gynecological surgeon. It's an imperative for someone having
Mm,
fibroids to seek out a surgeon with this kind of training. And only did she remove all of those fibroids, I conceived my daughter 3 months later
wow.
and had a healthy, pregnancy, delivered
Oh
her
my
by
gosh.
scheduled C-section at 37 weeks. So that decision and choosing to see surgeons, like I saw 3 surgeons, 2 interventional radiologists, doing
Yeah.
that whole going through all of that paid off big time.
Yeah, no, definitely, definitely. You're like, "Okay, here's the fruits of my labor here," quite literally. Well, it makes sense why you couldn't get pregnant, holy cow, like
Yeah, but when women go, they're told that fibroids shouldn't be impacting pregnancy when they're not in the uterine cavity. They're usually told, "Oh, you have intramural or fibroids in the muscle or outside of the uterus. They shouldn't be
yeah,
impacting pregnancy." I think we just haven't studied it hard enough. I've
yeah,
heard so many stories of women getting them removed and then
and they
immediately.
get pregnant, yeah. No,
Mhm.
I'm thinking about the symptoms you were complaining about, the heaviness and the pressure and the constipation and that kinda stuff, and thinking about the average person who doesn't know that they have fibroids. Um
Mhm.
have you kind of talked to other people that had that experience where maybe they were kind of misdiagnosed and it took a while to get that diagnosis and maybe they were sent elsewhere, like, "Just deal with your constipation, it's just that." I mean, you know the story as a PT, so
Yeah. Yeah, 100%. I've seen
yeah,
people what I see really more often is people that have, like, been in physical therapy for 2 years for their sciatica, and they've been doing bird dogs and getting hot packs for ages, and they
yep,
had fibroids the whole time. And
yeah,
there's not enough acknowledgement in the medical system, even within pelvic floor physical therapy, there's not enough acknowledgement of the way that these conditions, fibroids, endometriosis, adenomyosis, the way that they can mimic musculoskeletal conditions and there's not enough education on differential
yeah,
diagnosis of those things and being
yeah.
able to refer people out if your treatment's not working.
Well, I think that works both ways, not only with pelvic trained clinicians, but orthopedic trained
Mhm.
clinicians, that they don't get enough, and, I think that also goes back to too, like, expectations if it truly is sciatica, it should get better in this period of time with this. If it doesn't
Mhm.
behave appropriately, that doesn't mean keep beating your head against the wall, right?
Mhm.
But how many patients have you seen that like, "Oh, well, I'm just not doing my exercises enough," or they're totally gaslit and like, "Oh, you're not
Mhm.
committing to this enough, or you're not trying hard enough," or "If you just do this more, or you just do this other thing." And it's not that at
Mhm.
all. Like,
Yeah,
how many times have you heard that
absolutely.
story?
So many times, and 50% of the human population has a menstrual cycle, and they go for help related to pelvic pain, back pain, hip pain, groin pain, all these symptoms in orthopedic offices as orthopedic surgeons, orthopedic physical therapists. Not a question about our cycles or our periods or our
Right.
symptoms. Not a question, except when was your last one? It's
Yeah.
such a missed opportunity.
I always used to joke, when I worked in a hospital-based outpatient clinic, all the, ortho PTs didn't wanna work with pregnant women because they thought that they could
Mhm.
spontaneously put them into labor. You can't do that. But no, they were just terrified of them. And I'm like, "They're eventually not gonna
Yeah.
be pregnant." Like, they're not
Yeah. They're just people.
I know, but it's just oh my gosh. So for you with your background, had you been in pelvic health before this? Like, had you thought about going into pelvic health, or was this the thing that kind of sent you in that direction?
This was the thing that sent me in that direction, was my
Yeah,
experience while still in physical therapy school. So, like, as soon as I graduated, I started taking Permanent Wallace courses and,
yeah,
getting the experience that I needed to start working with this population.
yeah. And then a lot of what you talk about, and I'm jumping ahead a little bit and kind of
Yeah.
rehabbing after these surgeries. We'll get to the surgery in just a second. Like your weightlifting background and that kind of stuff. Was that something that you always had as well, or something that you've kind of pursued since then?
Yeah, so that my weightlifting experience was kind of the catalyst for choosing to become a physical therapist. But like so many of us, I went into physical therapy school expecting to be a sports physical therapist. I got out of school and got the sports jobs and the fancy athletic center and was not fulfilled by that, and then ended up moving into pelvic health. But
Yeah.
weightlifting always came first and is kind of the foundation of who I am as a clinician.
I love that because when you graduated when?
2017.
Okay. Yeah. So there was a time and a place where, and I'm sure you've been told about these old wives' tales about how PTs like were so anti-weights and anti-CrossFit and all this stuff, and we're just like, "Rah,
Yeah.
so bad." And of course, now how many PT clinics do you see that are in like CrossFit gyms, and everybody's got a kettlebell,
Yeah.
everybody's got all this stuff, which I think is hysterical. But I love that you came to pelvic health with that like background of, "Hey, I'm gonna be active, I'm gonna lift weights," that kind of stuff, because that just wasn't a thing, and it's just so cool to see that's
Yeah.
you're like, "Oh, yeah, that's just what I did, it's very normal."
Yeah.
So I'm like,
Yeah,
"Oh,
and
this is so
even
cool, we weren't that way."
yeah, and even in the 10 years since, like, I started physical therapy school 10 years
Yeah,
ago, so even in those times, the narrative has changed so much. I think we still have a whole lot of work to do, especially in the physician side of things, but it's definitely changing.
that could be a whole separate podcast. Alright, let's go back. So you had your surgeries, talk about your pregnancy a little bit, like,
Yeah.
I mean, I'm assuming you went in knowing that they were gonna have a C-section. Um, were you nervous at all about kinda how it was all gonna go since you'd had these uterine surgeries before?
Yes, 1,000%. So the best thing I did between that open myomectomy and my C-section was I immediately jumped on starting a rehab process so I could get as much in those 3 months as possible before
Yeah,
getting pregnant. And that saved me because pregnancy that soon after surgery was did have its challenges. So I
yeah,
had to modify a lot of things in CrossFit a lot sooner than most people typically do. Like
mhm,
really trained people typically don't need to modify double unders and pull-ups and stuff like that all that soon. But I did have to modify pretty soon. I would
mhm,
start getting discomfort in around my incision area.
mhm,
Um, so that side of it was hard. I was lucky to not experience any fibroid degeneration. So a lot of people with fibroids do experience degeneration while they're pregnant of the fibroids because of the way the blood supply is getting
mhm.
rerouted and stuff, and that can be excruciatingly painful. But I
What
didn't have
is
to go through that.
yeah, I was gonna
Mhm.
say, what does that mean, fibroid degeneration?
So they lose their blood supply, so, like, as the uterus starts to give blood supply to the baby, the fibroids start to lose their blood supply,
Okay.
or
So
sometimes it's just
there's
one fibroid. It basically
okay, so there
starts to
was
die.
still some more in there that they didn't get out, or
They grew back almost
oh, geez.
immediately. Yeah.
Well, that's
So
no
when
fun.
yeah. So there's kind of 2 paths that can happen for women with fibroids and pregnancy.
Yeah.
Beside like, they can just not grow back and you can be one of the lucky ones, but
Oh,
you can also have them grow back because of the way your estrogen is surging and our hormones are
oh,
changing can trigger regrowth. You can also have degeneration, which is where the blood supply changes and they basically die or lose their blood. So that can be really, really painful. I didn't have that happen, but my
right,
fibroids did start to return immediately. And because of my history of 2 uterine surgeries already, I had to have monthly ultrasounds with a perinatal specialist, and they were worried about intrauterine growth restriction the whole time. So my
right.
daughter was always trending a little small. And then they were also worried about placenta accreta, which was horrifying. So there was a lot of consideration about whether I might need to have a C-section and a hysterectomy at the same time,
Jeez.
which they'll typically only do in really emergent situations because
Yeah,
it's such a bleeding risk to do it
yeah.
at the same time. So pregnancy itself was relatively comfortable and like mostly fine, but very traumatic for me mentally
Yeah.
with all of the extra monitoring and everything that I had to go through.
Oh my
But
gosh.
at the end of it, my daughter, like, just eked out above the guidelines for being growth restricted, so she was 5 pounds, 12 ounces,
Oh,
at 37 weeks, so she was teeny tiny, but she
she was a
was,
little bean.
normal. Yeah,
Good.
and
So
now
is
she's,
it
like, 90th percentile.
oh my gosh. So is it like basically a growth race at that point once you've conceived is like you ideally want her to grow as quickly as she can to take up as much space as she can?
Yeah, and then
Yeah.
the resources, like, my uterus was giving blood and resources to my fibroids and to her, and to
Yeah,
my
he's like, "You
placenta.
you get blood, you get blood."
Yeah.
Like, gee. Like,
And it was
"No,
not
just
a
her."
yeah. And I also
Oh,
gained 70 pounds on the journey, so it was not a matter of, like, under eating or anything like that. I did not have gestational diabetes, luckily, that also tends to run amongst people that have,
oh, jeez.
fibroids.
Yeah,
Um, so I got away from all that stuff, but it wasn't an
yeah.
easy experience.
Sitting here now knowing obviously everything went well, like, does that
Mhm.
like, do you look back at kind of your mindset during that time and you're like, "Yeah, I did everything that I could," or there were recommendations had you to do it
Yeah.
over again to kind of support yourself in a different way?
I think I would have worked less hard. So I was coaching CrossFit while I was pregnant. I coached until 30 weeks pregnant. So I think I would have pulled back on that. I think I was doing that in addition to my work. So I think I would have pulled back on that, rested more, slept more, been in more therapy to cope with because these doctors say the craziest things. Like the perinatal specialist that I was seeing said that my uterus was like Swiss cheese and just like really worked up this placenta accreta thing and, like, just had me really freaked out. And there was just no need to put it so top of mind and so front of mind the whole time. It was really, really traumatic. I should have had more therapy.
I don't think and this was probably a provider that's been doing their job for a really long time, because I
Yeah.
don't think providers understand the weight of the words that they say that mean nothing to them,
Mhm.
because the person they're saying it to might be the first time that that person's ever heard that before. So it's almost like it's like they're desensitized to it because they've said it so many times,
Absolutely. Yeah,
right?
absolutely. Mhm.
And that's something that I still will try and catch with myself if it's like something that I've heard a million times before. One just comes to mind from yesterday where at least once or twice a week I have somebody saying, "Hey, is this what my belly's supposed to look like after I had a baby? Is what is this? Is this fat? Is this tissue?" Like I still look pregnant. And of course, they're like 4 months postpartum and they look phenomenal. But like
Mhm.
you're like, "Am I gonna be like this for all my life?" And I'm like, well, but you have to be thoughtful because that person has never heard
Yeah.
your answer before, and even though I've answered that question a million and one times, and even though it's mildly irritating to me because they look
Yeah.
phenomenal, you have to be cognizant about those words. I mean, what do you
Yeah.
wish somebody had said? Like, how could that person have said that better to you?
Yeah, that's a really great question. I think, demonstrating more empathy and, communicating like, "Hey, there's a risk of these kinds of things potentially happening, but we're going to be monitoring for them, and you're gonna have, a team around you during your C-section." And even though we're paying attention to these risks, it's overwhelmingly likely that everything's going to be okay.
Yeah. That's
And,
better than Swiss cheese by far.
yeah,
A little longer. A little
yeah,
longer, but hey.
yeah, or giving me
It
some
didn't take
insight
that much.
into,
Yeah, exactly.
yeah,
It wasn't that much longer. Like your patient who's coming next,
yeah,
they'll be fine with the extra 20 seconds.
yeah.
Oh man. All right. So let's talk about your C-section and
Yeah,
because I think C-sections are hard. I had two myself. I'm not a fan of the whole experience because it's just not fun. But you already had, two surgeries. You're getting rolled in. Walk us through kind of what that experience was like for you, already having had, two major
yeah.
abdominal surgeries.
Yeah. Going into it, I was less afraid because there wasn't anesthesia and all of that, but it actually happening was a horrifying experience for me personally. The spinal was just the
Mm.
worst. Like, not the needle part of it, but being able to, like, the way that you could feel your legs, but you can't move them. Like,
Mhm.
you're aware of them, but you can't move them. That sensation was just,
Ugh.
I hated it. I hated
Yeah,
it.
I feel you.
Yeah. The actual recovery went pretty smoothly. Again, I'm really happy that I spent that 3-month chunk of time in between preparing and getting my strength back as much as I could.
Mhm.
And then, of course, you have all the feel good hormones of having a new baby. And I had a lot of relief because my baby everything turned out okay. So there was a lot of like feel good endorphins going on. So I'm sure that
Yeah,
contributed as well. But my recovery went pretty smoothly.
that's good.
It was easier in a lot of ways from my myomectomies.
Yeah, I was gonna say, how do you compare those? Because essentially they're very similar.
Yeah.
Um, but obviously myomectomies, you don't get to take home fibroids that are adorable and
Yeah.
cute and take care of them. What was that experience like kind of
Yeah.
comparing, the myomectomies versus a C-section?
Yeah. So a C-section is a lot faster, especially like I had complicated myomectomies. So my myomectomy took like 4 hours. A
Mm,
C-section is of course much, much quicker than that. So there's just less time being manipulated. And then in a myomectomy, especially when you have 47 fibroids removed, there's a bunch of spots on your uterus that are also have been repaired and stuff. So my myomectomies for me were more painful, but that's not the case for everybody. A lot of people would say the opposite, that their
mhm.
C-sections were more challenging. So
Now
I don't
did
think there's
they
any, like, perfect answer.
yeah, did they go back so same kind of scar line for all of them at this point or?
My C-section incision was a little bit higher. I don't know
Okay.
why they did it that way. I lost, 70 pounds when I was in about 2021. So I
Mhm.
have loose skin and a skin fold, so they had to use that tape thing to tape my skin up for my
Mm,
C-section. So I think that probably changed the landscape
yep,
compared to a myomectomy, and they ended up doing the C-section incision a little higher.
I gotcha, yeah. How was your recovery kind of taking care of a newborn and, another major surgery and, really you didn't have a
Yeah,
ton of time rehabbing from the second myomectomy.
yeah.
What did that kind of look like in the short term?
Yeah, it went really, really well. I was very pleasantly surprised. I did my first workout at about 3 weeks postpartum. When I say workout, it was, like, really gentle, some, like, light dumbbell snatches, the elliptical in my apartment building, stuff like that. And before that, I started with deep breathing, some mobility work, some just practicing abdominal contraction type stuff. But it really went very smoothly. The hardest part about that time period was breastfeeding. So women
Mm,
with a history like mine tend to also have, issues with supply and stuff. So I was pumping and triple feeding and doing all this stuff, and my milk supply never caught up to what, we needed. So we stopped around 11 weeks, 11, 12 weeks, something like
yeah,
that. So that was probably the most challenging part. But from
it's
a
hard.
physical standpoint, I was so proud of my body. Like the
Yeah,
strength training work that I've put in for years really, really paid off. And when I get to talk to a woman that's dealing with fibroids and is hoping to get pregnant within a few years, I cannot say enough how important it is to strength train, because when you have that new baby and you just had an abdominal incision, the stronger you are, the easier it is to get around, get up and down off the couch, to bend over. Like, I could change her diaper and swaddle her and do all that
yep,
stuff without it feeling majorly physically taxing at all. Versus when you don't have that strength in your posterior chain, your back, all the other places, and then you have an incision in your abdomen, it just it feels like much more of a hit because you don't have other parts to help take up some of that work.
Yeah. Do you think it was, almost beneficial that you'd had these prior surgeries? Because lots of times women, when they have a C-section, it's their first surgical experience,
Yeah.
which I had hip surgery, I had FAI surgery, I guess it
Mm.
was 18 years ago, so that was, like, my only surgical reference. So, I mean, it's something,
Yeah.
but
Mhm.
do you think that was, an asset to kind of be like, "Oh, this is no big deal. I've done this before."
Yeah. Yeah, absolutely it helped, and then just the familiarity with, like, the medical system, like, I've gotten
Yeah.
people out of bed after just having a cardiac bypass, so, like,
Mhm.
the level of comfort with medical stuff is
Yeah.
definitely an advantage.
Yeah, and I think also too, and I'm sure you see this, people that go into planned surgical scenarios versus unplanned. That's always
Yeah.
a different mental challenge as well.
Absolutely. So I was very happy to accept a scheduled C-section. There are doctors who will support women in having a vaginal birth after myomectomies. I didn't even go there. I was very comfortable with my doctor's recommendation to have the scheduled C-section. It's definitely a different animal when someone's hoping for a vaginal delivery and isn't able to have what they hoped for.
Yeah.
When you have to labor and then have a C-section.
Did that once, wouldn't recommend it.
Yeah.
No, that one my oldest, who is now 13, we had a lovely conversation last night about he was an awful sleeper as a kid, and of course now he's a
Mhm.
teenager, so Saturdays he sleeps till like 11, and we were joking about how he's lucky to have a sister and all this stuff. It's funny now, it was not then. It
Yeah.
was not then. I was like, "Dude, it took a lot to get you into this world. You're lucky
Yeah.
you have a sibling." No, but I think it's one of those things that, you know, and this is why I think conversations like this are important, because you don't know what to expect. And even if you think you educate yourself, I think like hearing truly kind of what these experiences are, times when I have shared what actually goes on in a C-section, like how cold it is in there and how you flop around like a flounder.
Mhm.
Um, because you've got all these endorphins running in through you, and then like the pressure before they pull the baby out, like all those little things. I think the more we can kind of talk about the specifics, it it's one of those things that if people have to go through it, at least they've got a heads up, you know.
Mhm.
um
Instead of
but
expecting that it's gonna be this magical, perfectly comfortable
yeah,
experience and full of
it's
romance and
right. No, I did a post, I think it was this fall, because, my daughter just turned 11 and she was my second C-section, and we had hoped to do a VBAC. Um, I actually did go into labor with her 2 hours before I was supposed to go in for the C. So I'm having contractions, and we had an agreement. We're like, "Hey, if it looks like she's gonna drop, let's go for it, and if it doesn't, we've got the C-section time, and this is September 10th." I mean, I didn't want her born on September 11th because I live in DC and went through it, so we weren't
Mhm.
gonna do that. Um they rolled me into the OR, and I'm crying, and the nurse is like, "Why are you upset? Your baby's coming today." I'm like, "I really don't wanna be here right now. This is really not.
Mhm.
I don't enjoy this. This is not fun, and the sooner we can get out of here, the better."
Yeah.
So if y'all can just get your work done and I can get on with my parenting, that would be great. But
Yes,
she just looked at me like
100%.
I was crazy. I was like, "No, I'm fully aware I'm walking home with a kid, but this is not fun."
Mhm. Yeah, like, I'm glad the technology exists, but it was not a good
No,
experience.
happy to be alive. Well, and
Mhm.
that was the funny thing is, when we weren't sure what was going on yet, I was like, "Look, I'm having contractions and they kinda suck. We might have to go in and do the C-section thing anyway. So while I'm sitting here watching Al Roker and the Today Show, can you guys pop something in there
Yeah.
because we really don't need to be feeling this right now.
Yeah.
We'll get a head start on an anesthesia, right?"
Yeah.
So, but anyway, I think it's one thing when you help other people kind of navigate through,
Mhm.
like C-section and surgeries and things like that. And I think it's a completely different thing when we try and be our own PT and kind of navigate these journeys and these pathways ourselves. Did you pull in additional support to help you? Did you DIY it? Like what was kind of your process kind of navigating this post C-section journey?
Yeah, my C-section was DIY. I think so I had my daughter in July. In May, I started like that following May, I started working with a personal trainer. So I do often have support from coaches and personal trainers and stuff like that. But in the initial postpartum period, it was DIY.
Yep. And I don't know about you, but, like, training-wise, I feel like there's more stuff out there than there used to be,
Mhm.
but I think trying to figure out the biggest thing is logistics. Like, if your kid's not sleeping or not eating or you're having breastfeeding issues, I wish you'd known Kelly back then, good grief.
Yeah,
Um
me too. That's where I could have pulled in support for sure.
Yes, the balance boob, in case you guys are interested. 1, she's hysterical, and 2, she's just like an incredibly smart lactation consultant, and she used to be a labor and delivery nurse and used to be my neighbor before we even got married, so we go way back.
Oh.
Anyway, point being, um, I those first couple of weeks, I feel like are so they can be nothing or they can be a lot of things. I mean, it sounds like you were feeling pretty
Mhm.
good to be able to start doing you're like, "Snatches at 3 weeks." I'm like, "Really? Good for you." But that
Yeah.
wouldn't have been my first call, but I mean, like, what said 3 weeks snatch to you? Like, what was the thing that was like, "Yeah,
Yeah.
this is the thing." It just felt
I
good
mean,
or
dumbbell snatches are my thing, like, I'm really good at them. But for context, I think I use 10 or 15 pounds in that workout
Mhm.
when I could typically snatch a 50 or 60-pound dumbbell. So it's
Okay.
always about context, it's always about the individual versus if someone struggles with 30
Right.
pounds, 15 pounds is probably not appropriate for them to
Yeah.
start with.
No, I was just cracking up when you said snatches. I was like, "Who does that?" And I'm like, "Oh, clearly it's your jam."
CrossFitters.
Yeah, but it's not like snatching to me again, and I this is probably confession time that is not surprising to anybody. I was a runner first before I became a CrossFit person, so I don't share the same love for
Yeah.
snatches.
Yeah. So running took me a lot more time to get back to comfortably,
Yeah.
especially after the extent of my fibroids. Just running in
Oh yeah.
general was pretty troublesome even before my myomectomy because the
Mhm.
pressure was just like unrelenting. So I
Yeah. I
struggled
mean,
with running for a long time.
what did the pressure feel like? Was it like in the front? Was it in the perineum? Like where was the pressure?
In the perineum and then rectally. So it
Oh.
often, felt like there was stool there when there wasn't.
Mhm.
Sensations like that, and a pressure so much that there was a bulge, like, between
Mm.
the anus and the vagina, like, there was a change in shape there that is now gone, now that I've had a
Wow.
hysterectomy.
Wow. No, that's I think all that stuff is just having experienced that stuff before, do you feel like it sensitized you or, like, made you hyper aware of things or no?
But yeah, definitely, so I struggle with pelvic floor tension, which is a big thing.
Mm.
I've been through stuff like this, along the spectrum of severity, it's not that bad, it's something that I'm able to easily manage, but 100%, there are, like, probably lifelong consequences from, the last decade of being on this
Yeah.
journey.
Yeah. No, I think that's important too because, like, when I'm talking to a lot of clients, I'll ask them about, stuff that they did when they grew up or, instruments that they played or, sports that they played because, like, all
Yeah,
those things are culminations of kinda how we carry ourselves and what we do and so on. Um,
absolutely.
so did you have the hysterectomy with the C-section or was it after?
I had my hysterectomy after, so almost 2
Okay.
years after my daughter was born. It's pretty dangerous to have a hysterectomy with the C-section, so that was kind of, last, worst case scenario.
Okay.
Um, so I have had my daughter. The fibroids actually started to shrink a little bit in the
Hmm,
early postpartum period because that major estrogen to 0,
tank.
basically,
Yep.
the fibroids can, start to shrink a little bit, but then as I started feeling better and coming back into my normal, the fibroids started to rev back up again.
Mhm.
So my imaging showed about 7 of them. And this time around, I didn't wanna wait for the symptoms to become life
Right.
disrupting. So as soon as they started growing substantially, I scheduled my hysterectomy. I scheduled it with about 6 months, of time of notice, and I had my hysterectomy, and I was able to have it laparoscopically this time. So instead of waiting until it was so severe that they had to go back in through my C-section incision. So that was my
Yeah.
first laparoscopic surgery.
Was that recovery a little bit easier because it wasn't this big abdominal incision again or?
Oh, it was so different. Easier
Yeah.
is a yeah, it was different. So that's a soapbox that I get onto a lot is this idea that laparoscopic surgeries are minimally invasive. There was nothing minimally invasive about what happened to my body in that surgery. So
Yeah.
yes, the abdominal incisions are smaller and they healed very quickly, but they went in there, cut out my uterus with it ended up having 14 fibroids on the
Mm,
operative report. So they, cut out your uterus and they pulled it out through my vagina, which created vaginal tearing that needed to be sutured. So it's different, but it's certainly not minimally invasive.
right.
And something I try to really drive home about hysterectomies for people is it's a permanent change to your anatomy. So
Right.
they take the uterus out, and then if you're also having your cervix removed, which is almost everybody, they close up the top of your vagina and then hang it back up, basically. That there's nothing minimally invasive about that. And the
Yeah.
surgery is just called that because of the extent of the abdominal incisions, but it's like the abdominal recovery was easier, but nothing about it was necessarily easier. For me, it was more painful because they inflate your stomach with gas. So the gas pain and the digestive discomfort for the
Mm,
first few weeks was a lot. It was a very different quality of pain from my C-sections, my
mhm.
C-section and my myomectomies. So those incisions I would liken for me were like you did a wad with 100 GHD sit-ups in it. That's what that felt like to me,
That sounds
which is
awful.
it was a yeah, awful, but a very familiar sensation. The sensations that came along with my hysterectomy were unfamiliar.
Oh god. I was like, that just sounds bad, period. If you don't know what a GHD sit-up is, people who are runners, they basically hang you over the back of an object. It's like a barrel. They hang you off the back of a barrel and they attach your feet to something. And then you have to do like a full extension sit-up all the way up to a full sit-up. And so it's a lot.
Yeah, very hard on your abs.
Yeah. And to do a lot of them, that's not a fun
Yeah.
thing. Yeah, I feel like hysterectomies are something that I think, having been in pelvic health for a long time, it was really common to have patients with them a long time ago because that
Mhm.
was just, oh, you have prolapse or you have this, or you have that. And that was just like a very common thing to have somebody with a hysterectomy. I don't see them as much anymore. And, maybe it's just, that I'm seeing a younger population, um,
Mhm.
but the people who are having them, there's a lot of choices that you have to make. And I think also understand how the support and the architecture changes. I would love to hear kind of how you explain it. I explain it a little bit like a neighborhood. Like you have this neighborhood and somebody, takes a house out and then everything's going to like kind of take up the extra space. Like there's a lot of changes that occur. It's not the static situation. How would
Yeah.
you explain it now having gone through it?
Yeah. I try to always bring context to that individual's situation. So I typically don't just put out mass content where I'm explaining what happens during a hysterectomy because it varies so much for the individual. So like for me personally, having all of those huge fibers removed, I don't have that bulging in my perineum anymore. I don't have all of that pressure anymore. So yes, it's a permanent change to my anatomy and the neighborhood's different. I love that analogy, but the neighborhood is better for me.
Yeah, the neighborhood was not good. We
The
needed
neighborhood
to
was
get them out.
overcrowded,
They were hoarders.
but someone could hear a story like that from me, but maybe they're having a hysterectomy because they just got diagnosed with endometrial cancer. And the change in their neighborhood is gonna feel a lot different because
Yeah.
they felt relatively normal, and now they get this
Mm,
horrifying diagnosis, and now they're having their uterus removed, but they haven't been struggling with fibroids for a decade, so someone in those shoes, it's gonna be very different from someone in my shoes where I've been anticipating this with, eagerness for years.
right.
I was excited to have this surgery, but other people are in a boat where they're not, and that the symptoms that can come along with all of that context can be different from person to person.
That's a really important point, is kind of how you got there in the first place. With you, you're just like, "Yeah, I'm definitely looking forward to this," and I think a lot of cases, either people aren't because of cancer or something like that you said, or,
Mhm.
um but I feel like, again, before they're like, "Oh, well, you're done having kids, you don't need your uterus anymore."
Yeah.
Um, when you're working with those types of patients that have made that decision, like, what do we know about the uterus? I mean, obviously, yours was not doing you any favors.
Yeah.
or the fibroids using it for a home wasn't doing any favors. For
Yeah.
those people that are kind of just making that decision, like what do you kind of see them? What process do you see them kind of walk through where they're like, oh yeah, I don't need it anymore because I'm done having kids? Like,
Yeah, yeah. I mean, the uterus definitely does provide some support. It contributes to sexual pleasure and satisfaction to some people. So that can change for a lot of people. And when you look at the research, it'll tell you that outcomes are overwhelmingly good, but that doesn't mean much to the person who didn't have that great outcome and now
right,
feels a big change in what they experience during sex or orgasms, or now experiences a major change in their bladder function, which can happen. Doesn't
yeah,
matter what the research says for those individuals that are now struggling. Um, but I'm a big believer that if someone chooses to have a hysterectomy and they've explored their options and they believe that that's the right outcome for them, then they deserve the help afterwards. And
yeah,
we can do so much to help them overcome these complications that can happen.
yep,
And what I've seen a lot in the rehab and like holistic space is kind of a lot of fear mongering, a lot of judgment towards women that choose to make that decision as if it's always the wrong one, and it's not always the wrong one. A lot of people are very happy that they go ahead and do it.
yeah. So that's a whole side question of itself. Like, who's having these conversations? Because I'm not seeing it in the pelvic health space. We're
Mhm.
all too concerned about other mainstream things. Where are you seeing people turn for answers here? And why
Yeah.
is it not us?
Yeah, it absolutely should be us. A lot of people are working with the naturopaths, for example, and a lot of people do end up working with physical therapists. I see a lot of people who have tried acupuncture for like endometriosis symptoms and stuff. But in that space, there's just so much anti-surgery messaging
Mm,
that I've seen so many women that have been suffering with symptoms for 15 years because they're so afraid of having a hysterectomy. And then they do it and they're like, oh, like this is so much better. This is so
right.
much better. I should not have been so fearful of it. There are a few physicians that I know of that offer basically coaching services. So there's one physician, her Instagram handle is the fibroid doc.
Mhm,
She offers telehealth coaching sessions for anyone. It doesn't have to be in her state of licensure. She'll talk through these nuances with people about their situation and what treatments might be available to them, what medications, and so on and so forth. I think we need a lot more of that. We need a lot more people who are well informed and aren't choosing a side with Western versus Eastern or holistic
mm,
type medicine, but are well versed in all of it and can help people truly understand the risks and benefits of all of it. Because there's risks to surgery, of course, there's always a risk to surgery, but there's a risk to not having surgery too, which can
mhm,
be ending up like if I would have continued to pursue um, holistic avenues for my fibroid situation, I might not have my daughter, and that's
mm,
certainly a huge risk. So I think having people who are kind of in the middle who can talk about all of this is really, really, really important. I think physical therapists could really serve that role
yeah,
of being able to counsel people through what might this surgery look like for your life, for your activity level, for
right,
your injury history, and the reasons behind why you're having surgery. We can speak to so much of that stuff, and we just don't have
yeah.
enough awareness. And I don't think it's like this a population issue. Like between fibroids and endometriosis, there's plenty of people that we
Oh,
could.
yeah. No, 100%. And it's funny. I feel like we end up being like the social workers of the situation lots of times because
Yeah.
we're helping people navigate their providers. And
Mhm.
I th I worked in chronic pelvic pain for a really long time before I shifted more over into pregnancy postpartum. And I think where people can't find answers, there is a risk of kind of going down these uncharted water, rabbit hole, whatever things you want to call it, because sometimes those providers are the first ones who will listen.
Mhm.
And
100%.
then it builds credibility where it should not be.
Mhm.
Um, I'm thinking primarily. I think one of the conversations that's become more common lately is around hormones, and we can talk about that with your hysterectomy in a second. But for the longest time, I've had patients that would, do hormone testing or, whatever to functional medicine people, and they would go down these like woo rabbit holes and this and that, and um, because nobody would give them the time of day or actually listen to their symptoms or this or that. Same thing with
Mhm.
endometriosis. When
Mhm.
and then there's this distrust that's created towards Western medicine and surgeries. And I hate it when it turns good guy bad guy. I really don't like that
Mhm.
because we kind of just, but there are people that do take advantage of people's fears. And there are people
Mhm.
that, as providers, and I don't know if they realize they're doing it, they think they're helping. I don't know. I mean,
Yeah.
is that something that you see happen a lot?
Absolutely. There's a whole kind of subfield of people that are selling like endometriosis cures and fibroid cures, and some so extreme as to dissuade women from exercising because they say it
Mm,
increases blood flow to the abdomen and will worsen these conditions, which is horrific. The idea that you tell most women experiencing these things are in their 30s and early 40s. Like fibroids usually come to light in perimenopause.
mm,
Mine just happened early, but they typically come to light later in life. So these are women in the pivotal time in their lives when they need to be exercising, then they're being told not to. That is horrific.
that's not
So
good.
falling into these rabbit holes of people selling cures is really, really risky, which is exactly what I mean when I say there's risks to not having surgery too.
Yeah.
Um, so I think it's if anyone's selling a cure for these conditions, I think that can be a great indicator that they're probably not a trustworthy provider. Because if we had a cure for these conditions, we would have a cure for there's not like
Right.
some cure that physicians are withholding. I understand why people end up feeling that way, but that's not the case.
Yeah. Well, and good that you're aware. I feel like we have to be aware as providers, kind of trying to help counsel people through and help them make choices. You have to be aware of what kind of is on the other side and all the choices that are out
Yeah.
there, because like you don't know what's coming out of the woodwork there, you know. Um, you said something just a minute ago about how most people that are diagnosed with fibroids, it happens in perimenopause. How does that make sense considering perimenopause, we're nosediving into lower estrogen state, but these fibroids tend to be fed by estrogen? How does that all work out?
Yeah. It's the estrogen roller coaster
Yes.
period. So as the estrogen skyrockets and
Okay.
plummets, that can start to drive growth. There's also some, thought process around the idea that as progesterone starts to decline, your estrogen's not necessarily rising, but now it's more dominant over the progesterone, and that can also help to drive growth.
Gotcha. So one other thing that poor women have to
Yeah.
navigate in perimenopause. Oh, such a joy. Which, of course, we got none of this in school either. And I mean, even on
Yeah.
the Women's Health Board exam, I think we had like a paragraph to study on menopause. Granted,
Yeah.
this was 15 years ago, but um,
Yeah.
yeah,
It's
could have upped
just
the content
gratitude.
on that. We're just doing the
Yeah.
DIY course now.
Yeah.
Um, okay, so for somebody, let's jump ahead to hypothetical person in perimenopause who like,
Mm.
how do you now differentially diagnose this person that maybe they had a couple of kids, maybe they have prolapse, these
Mm.
regular postpartum things. How do you differentiate that between some of the symptoms that you're saying come with fibroids?
Yeah, it can be really hard to differentiate in that
Yeah.
situation because if someone still has their uterus, still has the cycle, they'll often experience worsening of prolapse type symptoms with their cycle, which can happen with fibroids too. Versus if someone was feeling like a more constant pressure, like fibroids are a mass, they don't come and go. So if they're feeling a more constant pressure, that would make me think fibroids. But definitely, if things are changing, if people's periods are changing, whether they're getting heavier, getting lighter, or getting longer, they're spotting for longer periods of time, I think that warrants an ultrasound to find out if there's anything going on in the uterus, even
Yeah.
if we already know that they have prolapse.
Right. And that one's tricky too, because I have more clients that are on like IUDs and things like that. So we're really losing that piece of
Yeah.
information. Um, a curiosity I have about IUDs, and I've seen this more with patients with endometriosis, is you'll have patients with endo on an IUD, and they'll still get bleeding. I'll have some people that have just spotting, and then I'll have people have nothing at all. Like I don't know if there's any correlation. I don't think anybody's done enough research on
Yeah.
who's to say who bleeds on with an IUD and who doesn't. But yeah, it just makes it so a lot of these things you kind of have to just sit down and be like, is this behaving like a prolapse? Are there other things that make us think that it's not? And
Yeah.
get a provider on board to get imaging. Because I've had clients before, they're like, oh, hey, let's go get this checked out. There's a fibroid. And as soon as they get the fibroid removed, they're like, hey, all my symptoms are better. I'm like, great,
Yeah.
beautiful.
Yeah.
Check, done.
Yeah.
And then you don't freak
Yeah.
out about the prolapse anymore.
Yeah, and I like to tell people that if you let's say you have prolapse, a lot of people that have been pregnant have prolapse.
Yes.
If let's say you already have prolapse and you have a fibroid, removing the fibroid is only going to make it easier to treat the
Yes.
prolapse, even if
Ex-
you have both. Even if you don't have a
Exactly.
magical situation where the fibroid's removed and all your symptoms are gone,
Right.
the symptoms that remain after fibroid removal are going to be easier to overcome
Yeah.
once the
That's when I
fibroid.
kind of do like when they have a diagnosis, 'cause I'm like, great, that actually is a really good news because that we can get taken out.
Yeah,
Um, okay. So for you, it's been how many years? Like how old's your daughter now?
she's 2 or
Mm.
26 months.
Oh, okay, how's that going?
Good, good. She's a very spirited child. We're getting through it.
How's the foot stomp eye roll stage? Has that started yet?
It's here. Yeah.
Girl moms understand, boy moms do not. Um, that doesn't go away, by the way. I thought it
Yeah.
would, and it doesn't. It just gets worse. Occasionally, my daughter is 11 now, and occasionally she'll still do it. But the problem is now I just laugh in her face, which she does not like any more than she did when she was like 2 or 3. So,
Aw.
but then she starts laughing too because she thinks it's funny. So yeah,
Yeah.
when they're little, they just get mad.
Yeah.
So for you, what is staying fit at this point look like? You're a couple years post surgical. You're how many months
Mhm.
after your hysterectomy now?
It's been 5 months.
5 months.
In May.
Do you feel like you're back working out and taking care of your daughter just like you kind of were before? Or do you still feel like you have a ways to go?
I feel stronger than ever right now. I feel stronger and better than I felt in a very long time, in a great way, especially with fibroids so severe. Like, I can feel the way that my body is working again instead of having
Mm,
that constant inflammation. Um, I also think we need a lot more research on the way fibroids affect us systemically, but I've done a lot of my own personal lab work and I have a highlight on my Instagram about it. But my systemic inflammation measures have gone down, my thyroid function has gotten better, my insulin resistance has improved. I've lost body fat more quickly. I just had a DEXA scan, which I shared there, and my body composition stuff is coming along well. My whole health picture has improved
wow.
substantially, and I feel amazing.
I was gonna say, like, that's gotta feel good that you're like, okay, all these decisions, all these hard
Mhm.
choices, all this stuff, it's definitely the right choice. What's kind of the prognosis for you kind of looking ahead at, perimenopause? I'm not sure how old you are, but like perimenopause and all that
Yeah.
other stuff. What does that look like for you?
Yeah. So I'm 34. Women that have fibroids that started younger in life, that got their period earlier in life. I started my cycle in the 4th grade. So I check all the
No.
boxes for someone that is likely to struggle with perimenopause symptoms earlier in life. There's
Yeah.
also a little bit of evidence now that having a hysterectomy does kind of speed along perimenopause, and people who have been in shoes like mine will end up having symptoms earlier.
Mhm.
Since surgery, the only thing I've noticed is really severe breast tenderness like I've never had before, and that happens cyclically. So that's something I'm just, paying attention to and not stressing over it, just loosely paying attention to because that could be some insight that symptoms are starting. And I've had the itchy ears and itchy eyes since
Oh.
surgery, like really dry, itchy eyes, and that's been nothing I've ever dealt with before. And so those can be some indications that people are starting to struggle hormonally after surgery. The people that I see struggle the most are women that are already perimenopausal and like they were already having some symptoms and they have a hysterectomy. They do tend or seem to struggle with their hormones after. So they'll experience mood changes, irritability, hair loss or hair thinning, just hair and skin changes, bloating, digestive stuff, all of the, perimenopause does everything. But I am a fan of people tracking their cycle after surgery and
Mhm.
continuing to track their cycle because once you don't have a period anymore, you can't depend on that, of course, to
Right.
be able to help you figure out where you're at. So I am a fan of people paying attention to their bodies and tracking their hormonal symptoms and getting help sooner rather than later if that's
Yeah.
something that they want to do.
So for people that don't understand, when you have a hysterectomy, you can take a bunch of different things out. You had your uterus removed and they kept your cervix and your
I had my cervix removed too. I
oh,
had
you
my
had
uterus
that too.
and my cervix removed. I
Okay.
kept my ovaries, and the traditional narrative is that keeping your ovaries means they're gonna keep working and you won't have any problems, but that doesn't seem to be the truth. And more recent research, we have a very minimal amount, but more recent research seems to indicate that the ovaries do slow down, at
Mhm.
least for a period of time after surgery.
And are there any symptoms that do you still have kind of cyclic stuff that occurs? Yeah.
Yeah, so that breast tenderness,
Yep,
it's
that's right, you said that.
new and severe, but it is cyclical. That's and my mood and my weight. So I still gain a couple of pounds for about a week and a half every month, like that all is still
Fun
happening,
stuff.
and it
Yeah.
still seems to be happening pretty cyclically. So if that
Okay.
started to change or my symptoms I started having other more uncomfortable symptoms, that
Mhm.
would cue me to start looking into my hormones.
Gotcha.
Um, I'm also a
And so
big fan
that's
of
something
getting,
tracking.
like, a baseline measurement after
Yep.
surgery, so I think people should get a DEXA scan. I think they should get just a basic hormone panel and a
Mhm.
basic metabolic panel to look at insulin resistance, thyroid function, all that stuff. If you're
Mhm.
choosing to have a hysterectomy, like, now is the time to get a indication on your overall health and where you're at with your body composition, your bone density, your lean mass, and have a baseline for that so you can
Yep.
retest it every few years.
Gotcha. And then kind of looking ahead, let's say you do consider hormone replacement therapy. Um, Standard that we talk about a lot is, oh, well, if you don't have a uterus, you don't need to worry about, needing progesterone with estrogen. What is kind of the path as you know it or as you're considering it looking forward?
Yeah, so the more leading menopause specialists would say that that advice is kind of outdated and that there are many benefits to progesterone aside from just protecting the uterus. So the people that I work with that are on HRT post surgery and are, get access to the best doctors and stuff, they are typically on at least estrogen and progesterone. A lot of them are also pursuing testosterone,
Hmm.
and those people seem to be the ones that do the best, the ones that get custom, treatment that
Yep.
is, given based on their symptoms and what they're experiencing. And there's not enough companies doing this kind of stuff, but there are more and more companies popping up that are there to support women. So I work with a lot of people that also work with telehealth companies that do like
Yep.
quarterly blood panels and stuff like that to help prescribe their hormone therapy.
Yeah, I think that's incredible. Just having, grown up in an area that, the closest major hospital was 70 miles away, like we need to have better access to
Yeah.
places where, and also that your provider is not limited by your zip code. We're
Yeah.
lucky here in the DC metro area. We've got some great, forward-thinking providers, but that's not always the case.
Yeah.
So it's
It's
nice
really,
that
really
this,
hard for people
yeah,
to find care.
exactly,
Getting
exactly.
better little by little, but that's exactly if I were to start to struggle, that's exactly what I would do. I would go straight to one of these telehealth providers.
Yep. I will put in, props for progesterone. That helped my sleep so much. It was I had a physical last week, and, I've known my GP longer than my husband, and my husband and I have been together 20 years, which is kind of awkward when you think about it, but my husband also goes to my GP. So anyway, he's like, "Oh, well, how's your sleep?" And I'm like, "It's great." He's like, "Really?" Like, "Yeah, it's great." He's like, "I don't get that very often from." I was like,
Yeah, yeah,
progesterone, I'm just saying.
yeah. And that's one of the
Just
first things that I've seen people. That's one of the things I see be the catalyst to people getting HRT the
Mm,
most is waking up at 3 AM and not being able
mhm.
to fall back asleep.
Yeah,
And
that
so
or
often they're only like 39, 40, and they're told
mhm,
it can't possibly be
right.
hormones.
Ask your mother when she went through it because I was
Mm.
6 years late in asking my mother that question. Apparently, my mom went through it at 41, and I asked her when I was 47, so, little late to the show there. So unfortunately, where I love you, mom. Unfortunately, where I didn't get a lot of information, again, she didn't know. My daughter
Yeah.
is getting way more than she bargained for. So we talk about it. My son's getting way more than he bargained for. Okay, let's let one last topic here before we wrap up. I want
Yeah.
to talk about resistance training and talking about it in the context after hysterectomy because I think sometimes people are told historically after surgeries you're not supposed to lift things anymore, which I'm sure you and I adamantly disagree. How do you start to have that conversation with people about, hey, not only is this a good thing for bone density and your health, but just like you're going to feel better in general. And no, you're not going to break yourself or anything like that.
Mhm. I think women are realizing how much damage has been done by that kind of overly conservative advice. I think they see it amongst their own parents. I think they see
Yeah.
the result of that stuff. And most of the women coming to me are looking for support in resistance training because they know that they need to resistance train. They know the benefits already. I'm very rarely having to convince someone of the benefits these days, which is amazing.
That's great. They know what they're buying.
Yeah. But and surgeons are also getting less conservative little by little and starting to give some really great, like, recommendations and advising women to strength train, which is also amazing. But less and less am I having the conversation about why people need to do it.
Yeah. No, I think so too. And I think those days of having to convince, because there's
Mhm.
more and more women like you that this is where you started. Some of us got to it a
Mhm.
little bit later. I started when my youngest was 3, but there's more and more people that are kind of understanding weight training. You need to do this. Runners, we're still working on convincing people that they need to do more than run. It's a process. Hang there with us, but we'll
Yeah.
get there. We'll get there. No, but that's great to hear that like that's not a hard sell because for so long and even like C-sections when they scare the crap out of you, like, "Don't lift your child." I'm like, "Well, you tell that to
Mhm.
them." Like, they don't care. Your toddler could care less what you just went through, and if they're upset and need to be consoled, guess what? You're lifting the toddler.
Yeah,
Um,
100%, and
so
amongst hysterectomies, like, a lot of women having hysterectomy also have a toddler or a young child or a family to take
mhm.
care of, and to be told you can't lift anything more than a gallon of milk for 6 weeks, women feel how wrong that is. Like, they
Mhm.
know their instincts are immediately that that's not right, that doesn't make any sense, and I think more and more they're looking for more support on understanding the nuances of like, okay, I need to do this thing. I need to lift my toddler. How can I do it better? How can I do it safely? What should I
Yeah.
watch out for to make sure that I'm okay? And women deserve that kind of information versus this
Yep.
black and white lift, don't lift
Yeah.
kind
No,
of stuff.
and I do appreciate that that's where things are going, and as much as there's, the double-edged sword here, I do think social media has done a lot for people to realize that these outdated restrictions are not carved in stone and that there are people and that's why again like I feel like your story is so valuable is like you are a mom, you have gone through all of this stuff, you know what's required of you to do your job as a mom and then your job as a PT and that sort of thing too, like you have like a
Mhm.
decent sense of reality, which don't
Yeah.
lift anything for 6 weeks. Like, come on, give me a break. Or don't use your abs. I'm sorry, to breathe, I'm using my abs. Like, come on.
Yeah, and the damage that kind of
Mhm.
advice does can be so enormous. I've met
Yep.
with women that had a hysterectomy 15 years ago and have never done a sit-up since. So
Yeah.
now what's happening every time they sit up out of bed after they've deconditioned that function for 15 years, now every time they sit up out of bed is a physical challenge and a
Yep.
much higher pressure, higher intensity environment than it needs to be. And now they're at risk of having trouble. So I think as a system, as a collective, we need to zoom out and
Yeah.
what's the long term, like 10, 15, 20 years, what's the repercussion of this fragility advice?
Yeah.
And how much better off would women be if we gave them more nuanced advice? Like, I don't think most people should be running 6 weeks after their hysterectomy, which
Yeah.
is normally when people are cleared. I think
Right.
people should do a consistent strength training program first and a return to run plyometric program and do all this stuff just like after postpartum. I think they should prepare for running, and most people aren't ready to run at 6 weeks, but I don't think that we should instill fear that they should never run again. It just needs to
Yeah.
be a more deliberate process.
Yeah. No, I agree with you. I've had a couple clients recently that their kids are, out of college and they were diagnosed years and years ago with prolapse and given these very severe restrictions. And then other providers continue to reinforce that over the years to like check their strength to make sure they haven't lost anything if they stop doing their Kegels or whatever. And like the fear is real.
Mhm.
And when you have somebody that like logically understands, like, oh, wow, things have changed and this is like they get it logically, but that fear is so ingrained It's
Yeah.
so you really have to be intentional about walking them back. It's almost like an addiction that
Yeah.
they were taught this, and I've apologized. I was like, "Look, I'm really sorry because our profession did nothing to help you back then because that's just what we thought."
Mhm.
But to get people to understand, yeah, there's so many nuances now. There's so much more that we can do. There's a huge chunk of the population that we're gonna have to walk back from some of the stuff that was said and done
Yeah.
and so restrictive a long time ago. Again, we didn't help with that, but we didn't know any better. So
Yeah, yeah, absolutely.
huh.
And I unfortunately don't get to reach that part of the population as often as I would love to. I'm often working with people that kind of already get it. They're already fit, they already lift, and they're
Yeah.
relieved to find someone that will support them in that. That's usually the demographic I end up working with. But I'd love to see people reach those people more often.
They'll come. They'll come. And that's and again, it's hard too when they're told, okay, you can only do this and you can only do Pilates. And I'm like,
Mhm.
okay, well, we need to lift something. And a 1 pound hand weight ain't
Yeah.
it. Baby steps though, baby steps. So all right. At the end of every episode, we ask our moms some questions. So, first one, mom of a 2-year-old. I don't know if you have any books that aren't like Goodnight Moon, but book you're reading or podcast you're listening to right now.
Yeah, I am rereading the book Burnout by Emily Nagoski right now. I read that book every
Ooh,
few years.
why every few years?
It changes my life has changed a lot in the last few years, so the
Just a little.
context of the book changes a lot. Like, last time I read it, I was a pregnant CrossFit coach and physical therapist, and now I'm a mom of a 2-year-old and a business owner. So it's constantly changing, so now I'm reading it in the context of being my own boss.
So trying not to burn out on that. Yeah.
Yeah.
I I I would read it now as business owner, mom of 2 pubescent children going through menopause, and the world's exploding
Yeah.
literally. If you guys don't know, Jocelyn's based out of Miami, and I knew she was in Florida, but I was like totally freaked out. I'm like, we should not be recording this because Milton's coming today. I'm like, I love you, but no. But she's in Miami and she's safe. She's fine. So if anybody, this is going to air after Milton. Hopefully everybody was okay. But Jocelyn's fine.
Yeah.
All right. Favorite activity since becoming a mom?
Taking her to gymnastics and all of she
Oh,
also goes to these classes called Kid Strong. It's a chain that's in a few major metropolitan areas, but taking her to this stuff and seeing her, like, physical development come along has been amazing.
yeah. It's fun to watch them. We're at the stage where we've tried a bunch of things for a long time, and now they're starting to kind of sort through what they want to do. And
Mhm.
I love my daughter's just like she's still just having fun with her friends, and I love that she's
Yeah.
not intense because that's very much I don't know what the vibe is in Miami, but we're a little intense up here in the DC area.
Yeah.
So,
Here too. I'm hoping to
oh,
avoid to that side of the sports culture, but seeing
this
her, like, look forward to going to gymnastics and knowing
yes.
her coach's name, it's also sweet.
Fight, fight this yeah, keep fighting the good fight if you need help with that. I'm happy to help. One piece of advice for moms, especially ones that are either considering kind of navigating pelvic surgery or who have done that like yourself.
Yeah, if navigating considering having pelvic surgery, seek out a highly qualified fellowship trained surgeon, not just your local OBGYN. If someone's delivering babies on Tuesdays and doing hysterectomies on Wednesdays and rejuvenating vaginas on Thursdays, they're not the person that should be doing your surgery, especially if you have endometriosis or a more complex situation. It's worth it to travel and seek out a specialist.
I
You'll
think
get back to
that's
your family faster.
That's great advice. And get there sooner than later. I think sometimes people are like, "Oh, but my doctor is so nice." My parents do that all the time. They're like, "Oh, I met this nice DPT. They have a DPT just like you," and they're like a year out.
Yeah.
Like, "Mom, they can be nice and super green." It's all good. Find the person that knows what they're talking about. Parents are lovely. Okay, who's somebody in the pelvic surgical space that we should know about? Like, who have you kind of fangirled over having gone through this whole process?
Yeah, so there's a physician that I love following. Her name is Mallory Upsterich. I think I'm pronouncing that correctly. But she is a surgeon that specializes in endometriosis and stuff and posts a lot of good content, not just about surgeries, but about the diagnosis of endo and adenomyosis. there are some like specially trained physicians that know how to read MRIs and whatnot in a way that can help to diagnose it versus what people are traditionally told is the only way to diagnose is through surgery itself.
Mm,
But there are places and people that you can get to that are more specialized. So she does a lot of great content that teaches people about more of those nuances.
awesome. That's great. And then last but not least, what does it mean to you to be now this active mom without having to deal with all this stuff?
Yeah, I mean, I'm excited for the future of being able to show my daughter, the benefits of living a healthy lifestyle and being able to tell her the story of what I went through to have her and the first 2 years of her life, and for her to see, how I've overcome that and am feeling better and again heading into my late 30s than I ever have in my life, and for her to have that example is an example that would have changed my life if I had had it. So I'm really excited to be able to do that for her.
That's so great. Does she have a barbell yet?
She does not. She has a kettlebell that she
Of course
calls
she
a
does.
heavy she calls it a heavy toy. It's like a little 5-pound pink kettlebell, and she calls it my heavy toy.
I love it. I feel like every CrossFit mom has like there's some plastic barbell set or something that
Yeah,
like kids start with, and then later on Rogue has this like little kids bar. So you've got
yeah.
plenty of things to look forward to. I'm glad she's got the kettlebell. I knew it was starting, and maybe she's doing snatches. I don't know. That's
Yeah, she picks
awesome.
it up and stuff. She's trying.
I love it. I love it. You see mom workout, we're gonna do the same thing. So all right. If you would like to know more, or if you're interested in working with Dr. Jocelyn, you can check her out on Instagram at Dr. Jocelyn Wallace. Thank you so much. One, for sharing your story, and two, just kind of opening our eyes to this whole other side of pelvic health. If you are a provider, follow her channel too, because there's a lot that we need to kind of be asking and questioning, whether you're in pelvic health or orthopedics. And then if you're a mom kind of considering kind of going through all this process, she's got some great content to put out there too. Dr. Jocelyn Wallace, thanks so much for joining us on the show.
Thank you so much for having me.
Did you enjoy the podcast? If so, leave us a 5-star review on iTunes and tell a friend to do the same. Are you a postpartum mom or postpartum pro wanting to know more about getting back to running after baby? Check out all my free goodies on carriepagliano.com. This podcast represents the opinions of Dr. Carrie Pagliano and her guests to the show. The content should not be taken as medical advice and is for entertainment purposes only. Always consult your healthcare professional for any medical questions.